Ready?
Mm-hmm.
Okay. So my name is Melanie, and I'm here to say hi, to repeat what he said. He touched a little bit on the Dignity, the Dignity Act, and how they just do it as because they are in a lot of pain and how they aren't informed correctly. In the Dignity Act, it states that two physicians must determine whether the criteria of them being terminally ill, they have to be met. There's also a timeline. First, they have to oral request it, and then 15 days later, they have to do another request. They have to wait another long period of time, and they have to do a written request to your physician, and then there's a 48-hour waiting period to pick up your medication. So they aren't just doing it as not being informed. They are informed. They have two physicians that do tell them that they will die within 6 months. He also states that they don't do it for the right reasons. According to N. Levy and E. Dahl, in the case for physician-assisted suicide, the most frequent reported reasons for choosing physician-assisted suicide are loss of anatomy, which was 87%, 80% had loss of dignity, and the loss of ability to join in the activities that make life worth living was 84%. 36% had concerns for being a burden on the family. 22% had a fear of being in excruciating pain, and that was a study done on 208 patients. He then talked about the Hippocratic Oath. According to Philip Nitschke, and he said over the time the Hippocratic Oath has been modified on a number of occasions, and as some of the tenets became less and less acceptable. References to women not being able to study medicine and doctors not being able to break the skin have been deleted. The much quoted reference to do no harm is also in need of explanation. Does not doing harm mean that we should prolong life that the patient sees as painfully burdened? Surely the harm in this instance is done when we prolong the life, and doing no harm means that they should help a patient die. Killing a patient, technically yes. I have an example from Robert F. Weir. In New York, a case study done, she didn't give her name, so they named her John Doe. She had a large cancerous tumor wrapped around her carotid artery in her neck, causing her esophagus to collapse, and it was invading her voice box. It prevents her from swallowing, therefore she can only eat very thin liquids. It has even become painful for her to yawn or cough. She cannot reduce her pain anymore to a comfortable level, or for her to remain in an alert stage. Her doctor says she is now in her terminal stages. She no longer wants to live in pain and suffering and wants to be able to discuss PAS with her doctor, but she is not allowed to because, well, physician-assisted suicide is not legal in where she lives. Another thing is that according to N. Levy and E. Dahl, again, they are very well informed because according to the Oregon Department of Human Services, which monitors compliance with the Death with Dignity Act, majority of the patients that are seeking physician-assisted suicide are financially well off. They are highly educated and have health insurance. So why would they not get a second or third or fourth opinion as to what's going on, get the best doctor and best care available so they are aware that this is what they want to do? Why take that away from them? Another instance is, according to Timothy Quill and Jane Greenlaw in framing the issues of physician-assisted suicide. Patients will find a way to do it anyways. They stopped doing their therapy. They even refused treatment to escape suffering for an early death. Some stopped eating and drinking to, make themselves die because they aren't allowed that the medicine that they can take for physician-assisted suicide. Others will do it kind of under the table. They will prescribe medication for aggressive management of pain and other symptoms, even if the dose is high enough to unintentionally make a death. And according to, again, Timothy Quill and Jane Greenlaw, this is ethically acceptable. Why would that be ethically acceptable to unintentionally have somebody die than to just prescribe them and do it? And that's it.